Welcome to Thriving with ADHD, a podcast where we'll share everyday practical tips to thrive in life as an adult with ADHD. This podcast is brought to you by Animo Sano Psychiatry, a behavioral health practice with a specialist ADHD clinic based in North Carolina. And this is your host, Nada Pupovac. Welcome to a special edition of Thriving with ADHD podcast, where we'll be talking about collaborative care, but this time from patient's perspective. We have Animo Sano's collaborative care director, Jennifer Street, with us, so let's jump right into that conversation with her. Jen, welcome back to Thriving with ADHD. I am delighted to have you back. And in the previous special edition episode, we talked about collaborative care model with a focus on providers. But today, we want to shift our gears and focus and educate people who need behavioral health care and explain how collaborative care model can help them to get to the treatment they deserve in primary care settings. So the whole point of this episode today is to explain how collaborative care model can make behavioral health care more accessible. So let's get into it.
Yeah. Thank you, Nada, for having me again. I really appreciate it. And I'm excited to explain a little bit more about collaborative care, this model, and how it can make a difference for patients. Just as you said, we talked a little bit more in regards to educating providers on our last podcast, but this model is all about the patients and providing accessible behavioral health care for patients. And so I wanted to just explain a little bit more with a patient-centered view on the model and how it may help them, how they can access more information, and what it may cost them. So patients are more aware of another way that they may be able to access behavioral health care besides the traditional models.
Excellent. So let's get started with the first question. So we need to know how the patient gets referral, how they get referred.
Okay, so if a primary care practice is already practicing with the collaborative care model embedded in their clinic, so a patient can go to their primary care provider if there's a behavioral health need discussed, if the provider picks up that the patient is having difficulties in a certain area, or if the patient verbalizes themselves that they would like to get some behavioral health care, then that primary care provider can refer them right into the collaborative care program. This would be with a primary care practice that is already engaging with the program. But that doesn't leave out patients that have a primary care provider that is not participating in collaborative care. If a patient wants to participate in collaborative care, they can do a self-referral into our particular program at Animo Sano Psychiatry. This self-referral will give us access to contacting their primary care provider, educating them on the model, and seeing if they would like to participate in the collaborative care model with their particular patient. So how the patient does their own self-referral, they can go on to our website. It's animosanopsychiatry.com. And they can access this collaborative care self-referral button there, enter just a short amount of information, and then our staff will contact their primary care provider to move forward with the program. So there's kind of two routes there that the patient could have access to collaborative care in their primary care practice.
So to summarize, the first route is if their primary care practice already is using the model, collaborative care model, but the second is if the primary care provider is not doing that, we can facilitate establishing the model with the help of our medical and admin staff. Correct?
Yes.
All right.
Yes, that's correct.
All right, excellent. So, how can the patient learn more about the program? So, I know this is a relatively new concept in behavioral healthcare treatment. So, how can people learn more? What it actually is? Where they can find information?
Um, so Nada, this is a great question. Collaborative care is it is known nationwide. Insurance companies are reimbursing for this. It is a recognized and well-studied model, but the education piece on it is still lagging a little behind. And
Mm-hmm.
so we're really trying to do our part to educate, as well as several other companies, foundations, and associations out there.
Mm-hmm.
So to start to gather more information, and this is for patients and providers as well, we have our website set up with a robust amount of information about collaborative care
Mm-hmm.
and specifically aimed at the patients in one section, for the providers in another. And then we have a great resource section as well.
Mm-hmm.
Our resource section on the website also has these specific links, and these links will also help provide a lot of other great information about the collaborative care model.
Mm-hmm.
One of them is the AIMS Center at the University of Washington. AIMS stands for Advancing Integrative Mental Health Solutions.
Mm-hmm.
The AIMS Center provides a robust amount of information around the collaborative care model, as they were the ones who have created this model and continue to outreach and educate as much as possible to get the
Mm-hmm.
nation to really understand the benefits of this model.
Mm-hmm. Mm-hmm.
Another one is the APA, which is the American Psychological Association. And they also are on board and really also trying to provide a lot of education. And then here in North Carolina, where we're located, the Area Health Education Center,
Mm-hmm.
North Carolina AHEC,
Mm-hmm.
they also are really trying to educate. They have multiple modules, learning modules for staff and for patients. And they have just um, a very robust amount of information as well. And they're really on board with helping to educate society and educate caregivers, and also educate providers on this model. So there's several ways to find more information on the collaborative care model and help patients, providers, admin staff, the whole team on really how this model can help patients and how we can really improve the access to behavioral health care
Yeah.
across the nation.
Yeah. Because that's part of our mission to get behavioral health care more accessible, and
Yes.
collaborative care model is there to help achieving this mission for
Yes.
sure. Excellent. Now, let's talk about very important thing, and that's how much this will cost the patient.
Yes. Um, so with collaborative care, it was designed to make it accessible to patients, but also to be cost feasible to patients.
Mm-hmm.
And it really is. So if a patient wants to engage in the program, they will see their primary care provider to get referred into the program, and they will follow up with their primary care provider as well. So they will have a copay, their just normal copay with their primary care provider when they see them.
Mm-hmm.
That does not have to be very frequent. It could be once or twice a year even,
Mm-hmm.
depending on what the patient needs.
Mm-hmm.
Then there is a copay for the collaborative care therapies that patients receive. The great thing about how it is arranged is that these copays are billed only once a month.
Mm-hmm.
So, if the patient needs to work with their therapist 3 times in that month, that's fine, and they'll pay one copay for the entire month.
Mm-hmm. Mm-hmm.
So, it makes it much more cost feasible for a patient to see their PCP maybe once or twice a year, there may be more, for that lower cost of a copayment.
Mm-hmm.
But then, even if they're working with their therapist multiple times throughout the month, they only are paying that one copay.
Mm-hmm.
That is significantly better for the patient's wallet than having to go see a specialist and pay specialty copays
Mm-hmm.
and pay specialty copays every time they see that specialist or that therapist outside of the primary care office.
Mm-hmm.
So it really is been developed with the patient's financial budget in mind as well.
Mm-hmm. And what about insurance? I suppose that's important as well.
Yes, so most major insurance companies across the US do participate in the collaborative care
Mm-hmm.
codes and reimburse the primary care providers for the care.
Excellent.
So that is also a great part there.
Mm-hmm.
If for some reason the patient doesn't have insurance, it doesn't stop them from engaging in the collaborative care program,
Mm-hmm.
especially with how our program is set up.
Mm-hmm.
They would just pay the service fee out of pocket. That service fee is a little bit more for the first month,
Mm-hmm.
and then it reduces as the months go on because
Mm.
we are expecting that the patient is getting better and won't
Mm.
need as much time. So
Mm.
the patient still can participate in collaborative care if they don't have insurance, and they would just pay the service fees that are associated. And
Mm-hmm.
honestly, those service fees could be much less than still going and getting private therapy or direct therapy
Mm.
at a psychiatry clinic. So it's still a reasonable way for a patient to receive care.
Excellent. And what type of therapies the patient can receive within collaborative care
So,
model? Yeah.
yeah, so the therapies are specifically um, kind of created or molded to the
Mm-hmm.
program.
All right.
There are typically 4 different therapies that the patient may encounter. They don't need to participate in all of them, but all of these therapies include patient engagement. They are time efficient, so the therapy types are built to be employed in a 20 to 30-minute session,
Mm-hmm.
and they're all very structured. So there's
Mm-hmm.
structured approaches to these specific therapies. So one of them is called problem solving therapy treatment.
Mm-hmm.
Um, and this is where the patient is working on solving problems here and now.
Mm-hmm.
So, what are the specific problems that are causing the patient to have depression or anxiety at this point in time?
Mm-hmm.
So, the therapist looks at those with them, discusses how to approach the problems and how to make changes in their life to improve
Mm-hmm.
the the current problem to move forward. Um, Another one is called behavioral activation.
Mm-hmm.
Behavioral activation is uh, is looking at the areas in a patient's life that they have stopped engaging in because of their
Mm-hmm.
mood.
Mm.
So, family activities, work, health, personal health care, just activities that they normally would have been enjoying that they've
Mm-hmm.
stopped doing.
Mm.
The process or the purpose of behavioral activation is to get the patient back in doing the things that they were doing before.
Mm-hmm.
Even if they're not feeling good, the goal is that you do to feel better.
Mm.
And so the therapist works very closely to identify with that patient areas that they need to start activating again in their life to start feeling better. Another therapy type is cognitive behavioral therapy.
Mm-hmm.
Um, and this is it's a short-term goal-oriented therapy that looks at interrupting the patterns of thinking that's preventing the patient from getting better.
Mm-hmm.
So certain thoughts that the patient is having that's kind of roadblocking them from making moves forward.
Mm-hmm.
And then there's one other, and this is called interpersonal counseling,
Mm-hmm.
and it focuses on current functioning, recent life changes, stressors or difficulties that the patient is really working through in the current time, and how to address those as well. So there's these 4 particular therapy types
Mm-hmm.
that our therapists are well trained in. They
Mm-hmm.
understand how to systematically approach
Mm-hmm.
these problems to help guide the patient through to recovery. And these therapies can be done asynchronously or they can be done also with medication treatment as well.
Mm-hmm.
So if the patient feels that there's a component of the anxiety that is really blocking them and they really do need some medication to help kind of get over that roadblock, then medication treatment is also very much engaged in the therapy, and that is where our psychiatrist consultations come in.
Mm-hmm.
And the psychiatrist on the team will help make recommendations on medications
Mm-hmm.
and help guide the primary care providers to prescribing the proper medication at the correct doses and
Mm-hmm.
also how to titrate them up and down for the patient so that they are receiving the best treatment plans that they can.
And what patients say about the program so far? What's their feedback?
The patients have significant positive feedback around this program because
Mm-hmm.
there's just been so many great outcomes from participating in a care model that involves your primary care provider, your therapist, and your psychiatrist
Mm.
all together on one team.
Mm-hmm.
So some of the feedback that we have is that patients are thankful that this is a tailored plan to their unique situation.
Mm-hmm.
So a patient that is dealing with depression and also has diabetes is going to be treated and their care plan is going to be unique to them,
Mm-hmm.
as different than a patient that has postpartum depression or a patient that has depression and is in cancer readmission.
Mm.
So, you look at this patient in a holistic way,
Mm-hmm.
and the care team is working all together
Mm.
rather than your primary care provider taking care of the diabetes, or maybe it's even an endocrine specialist. And then you have a psychiatrist completely separate taking care of your depression. And
Mm.
there's such a disconnect there. So the
Mm-hmm.
patients are really very thankful that the team is working together to make a tailored and unique plan
Mm-hmm.
for their specific medical needs. Other patients with just the improved communication that they don't have to go back and forth
Mm-hmm.
between different providers, constantly explaining what one said to the other. And also, it's very convenient for the patients. They can receive their health care
Mm-hmm.
where they are. They
Mm-hmm.
receive their behavioral health care in their primary care provider's office where they are, where it's close to them. And then it's also, a telehealth option as well. So they don't have to travel an hour to get to a behavioral health specialist. And it also reduces the stigma because it makes it more of a normalized treatment. And they're more comfortable seeking care and asking for care in a clinic that they've been going to with doctors that they have relationships with and trust. And of course, it improves outcomes. So the model, it's been studied, it's been proven, and we see it over and over and over again, patients saying how they've gotten better. And so, these are the areas of feedback that patients really are thankful for this type of care model.
So I would like to conclude this episode with the way we usually do, and that's, if there is one thing you would like our listeners to bring from this episode, any piece of advice, anything that people can relate to, what that would be.
So I think what I want to really highlight here is that receiving behavioral health interventions should not require specialty referrals. It shouldn't take 2 weeks to even months to get in and start your therapies. It should not be costing patients significant amounts of money to reach and access their providers. It should not have stigmas attached to it. And there should not be barriers to access behavioral health care. But there are. And collaborative care allows patients to receive care where they're at, when they need it, in a cost-effective way. And it's proven to work. So I would just like for the listeners here to educate themselves on the model, ask their providers about it, and reach out to us if you have any other questions. I'm really thankful to have had the time to explain more to the patients about how this could be helpful to them. And I'm always open for more communication and explanation if any patients need it.
Thank you so much. So I appreciate your time on our podcast. If people want to reach out to you and learn more about collaborative care model, they can visit our website. And let's remind our listeners, it's animosano.psychiatry.com. And we have a set of pages on our website dedicated just to collaborative care model. As we said, we have a section for patients, we have sessions for providers, and if patients want to learn more, they absolutely can do it. We have our monthly webinars. We also have direct contact to you. So if people want to learn more about collaborative care model, our website is a great starting point, and you are very approachable person and open to communication with providers and patients, so they absolutely can learn more from you. Thank you so much for your time. It was a pleasure.
You, Nada.
And hopefully this communication and conversation will encourage people to reach out and get help for their behavior health, because everyone deserves it.
Absolutely.
All right. So thank you so much. And hopefully we'll see you in another episode.
Thank you.
Thank you for listening to Thriving with ADHD. This show is produced by Animo Sano Psychiatry. Please follow, rate, or share our podcast on Spotify, Apple Podcasts, or any other streaming app of your choice. Music is by Daddy's Music from Pixabay. For more information about Animo Sano Psychiatry, please visit animosanopsychiatry.com.